Hey guys, welcome back to the channel. I know this has been a hard couple of weeks. We've had a bunch of tragedies happening in America right now that have been really hard for people to process. There's been a lot of chatter about mental health in the world. Again, this is what happens when we have mass shootings like what occurred in Buffalo, what occurred in California at the church, and then of course what happened at the school shooting down in Texas. The discussion regarding firearms in mental health is really important to have. In my 10 years just coming up of being a psychiatrist, including my residency training and out of practice, I've seen, hundreds, thousands of people who have survived suicide attempts. And the reason is because of the method of it. The lethality of a suicide attempt, oftentimes with an overdose, hanging, other things like that, is much less as compared to those from a gunshot wound. I don't think in my training I've seen anybody after a gunshot wound because they end up oftentimes dead. Suicide is the 10th leading cause of death in America. Over half of the suicides in America involve a firearm. So we're looking at it as these huge numbers, right? And we know the importance of it. When we're doing evaluations for people, when we ask about guns, access to guns, the reason is not so much for harm towards other people, right? Suicides outnumber homicides in America almost 2.5 times to 1. So again, a huge discrepancy. The reason that we're asking is more so, again, lethality for a potential suicide event for themselves. When we talk about suicides, when somebody has died by suicide, there are 3 main factors that are involved that are present. 1 is a feeling of hopelessness. 2 is access to things like alcohol, or oftentimes inebriation or other substances. And 3rd, the last one, is access to firearms. Again, because of the lethality of them. So with any field of medicine, there's always an emergency that's there and always a thing that's there that we're trying to prevent, right? When we're talking about things like cardiology, we're trying to prevent things like a heart attack. Neurology, we're looking to prevent things like a stroke, for example. In psychiatry, it is suicide. And again, those rare cases of homicide. I don't think in my career I've ever had to make a call to warn somebody of duty, maybe once, maybe twice, but again, hundreds to thousands of people that I've seen after a suicide attempt. Other thing also is when we're assessing for suicide, we have to understand that there's more than just, hey, I'm suicidal, I have intention, and I have a plan to do it. The last part of it is access, right? Do we have access? And we know that access to a gun, access to a firearm, I think the status triples the risk of someone dying by suicide as well. So when we do these evaluations, that's the reason why it is imperative that we ask the question, do you have firearms? Do you have guns? Do you have access to these things? If they're at home, how are they stored, right? Are they in a gun case? Who has access? Is ammo stored separately? Again, all these questions that are there that we need to know. And just as important, access, right? Can somebody go down to their friend around the corner and get a gun? Can they get it from somebody? These are big questions that we need to know as well. Guns are much more prevalent than we want to believe almost. I'm, personally, I can say this, I'm somebody who's never held a gun. I've never shot a gun. I've never gone to a shooting range, nothing like that. I have no interest in it, right? Because I know how dangerous they could be, how many accidents occur. I've seen this stuff, right? Working in medicine, working in the emergency room, working in Chicago, New York, all these places, and seeing this stuff up close and personal. There's nothing that appeals to me about it. I think I was reading somewhere 330 Americans, there's 400 million guns in the country. So guns outnumber Americans in America.